Introduction to Vision Impairment. Welcome to Deafblind Information Australia's training video series, made possible by an NDIS Information Linkages and Capacity ILC grant. My name is Emily McDonald. This module is titled Introduction to Vision Impairment. It was developed by myself and Melanie Robertson, project officers and deafblind consultants. I am a practicing occupational therapist and Melanie, a practicing speech pathologist. This project is managed by Meredith Prain. Deafblind Information Australia acknowledges the traditional owners of the lands on which this presentation was recorded. We pay respect to their elders past, present and emerging. Training Modules 2020. This training module is one of a series of 3 presentations for 2020. The other 2 modules in the series are Introduction, Deaf and Hard of Hearing, and Introduction to Congenital Deaf Blindness. Module Overview. This module will cover visual development, vision professionals, conditions commonly found with vision impairment, common childhood ophthalmic disorders, and visual fields. Anatomy of the eye. To understand how vision impairment occurs, it is important to first understand how the visual pathway typically works. On the right-hand side of the slide, there is a diagram of the visual pathway. This shows the lens, which helps to refract light to be focused on the retina. It then shows the retina, light-sensitive tissue at the back of the eye. The optic chiasm is the X-shaped structure, which is where the nerves cross over, which facilitates binocular vision. The optic nerve carries visual information through the optic tract to the visual cortex for processing. Vision impairment may occur at any point in the visual pathway. Where this damage occurs within the optic system will alter the functional impact experienced by the individual. Impact of vision impairment. The major impact of vision impairments include a lack of clarity, blur, and distortion. Fatigue also has a huge functional impact on the daily life of an individual with vision impairment. Glare can cause fluctuations in vision. Vision impairment is a disability of access. With increased accessibility and universal design, the impact of the disability is significantly reduced. On the right-hand side of this slide, there is a photograph of a leafy street with cars parked in it. The background of this picture is blurred. Severity of vision impairment. The severity of an individual's vision impairment depends on the timing and cause of the impairment. The age of the individual at the time when the impairment occurred will alter the outcome. Development of early concepts such as space, built environment, colours, and shapes, which are all key to learning and development, may be missing for someone born with a vision impairment. Vision impairment does not respond to treatment, and very rarely does vision get restored. The nature of the condition should be understood, particularly if it is a fluctuating or progressive condition. Any co-occurring health conditions will also impact on the individual's function and may be exacerbated by their vision impairment. Vision development. A child's vision develops from birth to age 8 to 10 years. It is important to pay careful attention to a child's visual behaviours, as early intervention and assessment are key to ensuring vision issues are detected early. There are defined critical periods of vision development with various theories about what these are, but it is generally understood that this occurs prior to 10 years of age. Impact on development. Vision impairment can have a profound impact on a child's development without early intervention. Motor development. Without early intervention, a child may be delayed in reaching, crawling, and walking, as they do not have the same visual motivation to reach for people and objects. If a child is not encouraged to make use of their hands may be floppy due to underuse. The child's walking gait may also be unusual, as they are not able to watch and copy the gaits of others. Cognitive development. Without early intervention, a child may have a disorganized understanding of the world around them due to sensory deprivation. The child may have difficulty integrating their other senses and making sense of the world around them. Social development. Without early intervention, the eye contact between parent and child will be impacted, which may impact on their early interactions. The child's visual impairment will also impact on the development of their social skills, as they may miss subtle body language clues. Emotional development. Without early intervention, a child may have difficulty understanding emotions, as they will miss subtle facial expressions. They may also experience separation anxiety from their parents, as they are not able to understand when they have gone and when they have returned. Vision professionals. Who can help my child? Ophthalmologist. An ophthalmologist is an eye doctor with specialist training in ophthalmology. They usually work in a hospital where they can diagnose and treat specific ophthalmologic conditions. Pediatric ophthalmologists will have more training in pediatric vision conditions and visual behaviours. Orthoptist. An orthoptist is an eye care health professional who specialises in the assessment of vision and management of eye movement disorders. They work with people of all ages, performing specialised tests to aid the diagnosis and management of eye disease and refractive errors. Optometrist. An optometrist is an eye health professional. They perform essential eye health screens and are skilled in assessing for refractive errors and prescribing glasses and contact lenses. A developmental optometrist is a skilled optometrist who will assess how vision is impacting on the child's behaviour, which may be an appropriate way of assessing a child's vision when they have limited functional communication skills. Optician. An optician is a professional who assembles glasses in accordance with the optometrist's prescription. Allied health professionals. There may be a wide range of allied health professionals involved with a child with a vision impairment. This may include an occupational therapist, speech pathologist, physiotherapist, dietitian, psychologist, social worker, deafblind consultant, the list goes on. Conditions commonly found with vision impairment. Refractive errors. Refractive errors occur as the shape of the eye causes light to bend incorrectly, resulting in a blurred image on the retina. Refractive errors are usually treated first when assessing an individual's vision impairment. Refractive errors can be corrected with glasses, contact lenses, or surgery. Childhood refractive error does not necessarily mean the child will have a need for glasses as an adult. Refractive errors should be corrected by glasses, as uncorrected refractive errors may pose a threat to the child's vision development. After 8 to 10 years of age, It is unlikely a child would damage their eyes by not wearing their glasses, as they have passed the critical period of visual development. Hypermetropia, commonly known as long-sightedness. On the right-hand side of the slide, there is a photograph illustrating hypermetropia. There is a man in the foreground with his hand outreached and he is blurred. The background of the photo is a street sign and a car, which is clear and crisp. Hypermetropia is the most common refractive error in children. This is a vision condition in which distant objects can be seen clearly, but close objects do not come into proper focus. These are treated with glasses or contact lenses. Myopia, commonly known as short-sightedness. On the right-hand side of the slide, there is a photograph illustrating myopia. The photo was taken inside a car. The dashboard and steering wheel are clear and crisp, but the street is blurred. Close objects are seen clearly. Distant objects do not come into proper focus. This occurs if the eyeball is too long or the cornea is too curved. This is typically treated with glasses or contact lenses. Astigmatism usually occurs with myopia or hypermetropia. On the right-hand side of the slide, there is a photograph comparing astigmatism with normal vision. The left-hand side shows a blurry flower field, and the right-hand side shows a clear and crisp photo. This occurs when the refractive error varies over the surface of the cornea, which causes blurred vision at all distances. This is treated with specialized lenses called cylindrical lenses. Presbyopia is an eye condition which is a normal part of aging. On the right-hand side of the slide, there is a photograph of an older gentleman holding a blue book at arm's length. Presbyopia occurs when the lens of the eye loses its flexibility and the eye loses its ability to focus. Objects tend to be clearer when held at arm's length. This can usually be corrected with glasses or contact lenses. Strabismus is another eye condition which is commonly known as a squint or turned eye. On the right-hand side of the slide, there is a photograph of a very cute baby whose eyes are out of alignment. The right eye is turned in. Strabismus occurs when one eye is out of alignment. This may be the first hint that an individual has a vision impairment. Without treatment, this individual may develop amblyopia. This is treated first with glasses, then with patching, then with surgery, if needed. Amblyopia, or as it's commonly known, lazy eye. On the right-hand side of the slide, there is a photo of a young boy wearing orange glasses and a patch over his right eye. Amblyopia typically impacts only one eye. It develops when there is a breakdown in how the brain and the eyes work together, and the brain does not recognize information from one eye. Early intervention is critical to restore the child's vision. Nystagmus is an eye condition which causes an involuntary to and fro of the eyes. On the right-hand side of the slide, there is a photograph of a baby adopting a peculiar tilted head position. The amount the eyes move for an individual may vary in different positions of gaze. Individuals may maximize their vision by adopting a head posture, which keeps the eyes in position of least eye movement. Common childhood ophthalmic disorders. Congenital vision disorders. There are many causes of vision impairment in childhood, which have a broad range of functional impacts on the child and adult as they grow. Examples of these include cortical vision impairment, albinism, retinoblastoma, cataract, and glaucoma. An orthoptist is a great person to ask for more details on the functional impact of these conditions. The Australian Childhood Vision Impairment Register is a project attempting to understand the most prevalent vision impairments in Australia, and their website is also a very useful resource. Visual fields. Visual field deficits. A visual field deficit refers to diminished or absent vision in a particular part of the visual field. There are several types of visual field deficits, which describe the area of vision that is impacted. The field of vision impacted is dependent on the position of damage within the eye. Examples of visual field deficits include homonymous hemianopia, quadranopia, scotoma, blind spots, and tunnel vision. The cause and functional impact of these deficits vary with each individual. It is important to understand if this is present to ensure the individual's safety, particularly when walking, navigating stairs, and potentially driving a car. For more information about deafblindness in Australia, please visit the Deafblind Information Australia website. The references for this presentation may be seen on the slide now and will be accessible on the website.